Hi, I'm Sue. I'm a nurse practitioner and the owner of About Face in Bristol, Tennessee. Today I want to talk to you about a problem that is very common with women. It's called stress incontinence and urge incontinence. Now, stress incontinence is where we laugh, we cough, we sneeze, we exercise, and we leak urine on ourselves. It's caused by the weakening of the pelvic sphincter muscle, and often it's due to the effects of childbirth or aging. Urge incontinence is a strong desire to urinate. The bladder squeezes and the urine is lost, and if the woman can't get to the restroom right away, then she will wet on herself. It's an stress incontinence and urge incontinence is an extremely common problem that can cause social and hygiene issues. Now, when I went to Alabama in last spring and I trained with Dr. Charles Runnels, the creator of all the vampire procedures, I was very interested in the treatment of stress incontinence with the O shot. One of the first patients that came to my mind was this young teenager I had in my rural medical practice that had to ride the school bus for 20 miles to and from school, and she would wet herself before she could get to school or could get home of the evenings. Therefore, she didn't want to go to school. We tried different treatments that really about the only treatments that were available at that time was telling her to wear pads, giving her medications that made her mouth dry, made her sleepy, made her feel bad, so she didn't want to do that. Now, of course, I did refer her to urology, but we never really got that problem solved, and so her mother ended up homeschooling her. So when I heard about the O shot and stress incontinence, of course, I was very, very interested in it. Now, today we can offer you wearing pads, we can offer you medications, we can offer surgery, but still this is not acceptable for some. And so this procedure called the O shot is when we take your blood, spin it down with a FDA approved centrifuge, and we re-inject that platelet rich plasma, the rich plasma that has your growth factors and all your healing factors in it. We re-inject that back into the tissue and into this localized region, and it causes these tissues to regenerate and improve their strength and the ability to prevent the urine from leakage. In many cases, this incontinence may be completely cured even with one treatment. I've had several women to tell me that after their treatment they had no more problem with the stress incontinence. The procedure takes about 15 minutes. There's zero risk and there's no downtime. So if this is a problem that you have or you know somebody that's having this problem, I welcome you to call About Face, set up a free consultation, and come in and talk to me about it. Let's see if this is the treatment that you've been looking for.